Hello, this is Nathan Radcliffe and welcome to Interventional Mindset. I am a glaucoma specialist and cataract surgeon, and today I wanted to spend a little time talking about the first FDA-approved intracameral sustained delivery implant for glaucoma, Durysta or bimatoprost sustained release. For many years, we've had three pillars of glaucoma management: eye drops, laser, and surgery. And in 2020, we received FDA approval for the fourth pillar of glaucoma therapy, sustained delivery. I wanted to spend a little time talking about two topics. One, finding candidates for Durysta, and two, talking to patients about Durysta. And really those two topics are the same because patients need to be willing and interested and excited about having the injection in order to really be candidates. So the first thing we're going to be talking to our patients about is why we would want to treat their glaucoma with an injection rather than a topical agent. And I think here we have to acknowledge that there are many limitations to eye drops, some of which patients may be aware of and others they may not. I notice that many of my patients, when the technician interviews them, will complain about dry eye drop side effects, redness, discomfort. They'll complain about trouble at the pharmacy, missing their drops, not being able to get refill, high copay, and they may even complain about running out of eye drops at the end of the month. That's a sign that they're probably missing their drops. And of course, we know that some patients who remember to take their drops and are even successful at the pharmacy still just can't hit the eye with the drop. And it's sad, but unfortunately it's the reality. At best, about half of our patients are taking their drops the way we'd really want them to be taking the drops. If you even step back from that, if everything goes perfectly, drops inherently have problems. Drops that need to be taken twice a day or 3 times a day, even the prostaglandin analogs, don't have uniform efficacy throughout the 24-hour period. This means that there's fluctuation inherent to eye drops, period. A sustained approach can eliminate all of the problems that I've been talking about for the past minute or so, from copay issues, pharmacy issues, running out, fluctuation, missed doses, compliance, irritation. All of these things can be addressed by putting the drug where it needs to be. Fundamentally, there's a consideration, which is, do we really think that for a progressive, irreversible, blinding disease, that patients should be entirely in charge of the treatment? And when I say entirely, if a patient is taking an eye drop, they are entirely in charge of their treatment. We make a suggestion by writing a prescription, but the treatment is entirely up to the patient. With Durysta, the doctor is in charge of the treatment. I believe that with a blinding, serious disease, that the more treatment we can put in the hands of the doctor, the better. And that's why I believe in Durysta. What I just exhibited to you, by the way, my belief in Durysta, is an important thing to show your patients. We can all get patients to have laser iridotomy because we all believe that's the best treatment for closed angles. When we show our patients that we believe in this therapy, they will understand that, and they will have confidence in us and confidence in our treatment recommendation.